Local and live, covering Franklin and Washington counties, it's Let's Talk TriState with Tiny and Katie.
Welcome to Let's Talk TriState, all powered by Home Right Windows and Doors in Waynesboro, the right choice, winner in the 2024 Best of the TriState Awards. I love our Ask the Expert segments, and today is no different. I also love, for whatever reason, have a fascination with the medical field in general. We have with us today Dr. Akia Caine. She is with Wellspan Surgical Specialists in Chambersburg. Doctor, how are you today?
Hi, I'm great, thank you.
It's wonderful to have you with us. We are going to talk today about robotic surgery, and we're going to be talking more specifically about the Da Vinci robot.
Yes.
Now, believe it or not, you wouldn't believe this, I've used the Da Vinci robot.
Oh, wow.
I have. I was so excited. Wellspan used to do a health fair in Waynesboro, and I remember the one year, one of the big talking points was, well, we have the new Da Vinci robot there, and you can actually use this, whatever, multi-$1,000, however many hundreds of thousands of dollar machine this is. $1 million. There you go. Okay, that's how many hundreds of thousands. And it was so awesome to be able to use that machine. Before we get into all that, though, let's talk about you. So take us through the evolution of Dr. Caine. Where were you born, and how did you make it to where you are today and wind up in your practice?
Sure. I'm from New York City, actually. Okay. Born and raised in New York City. I went to medical school in a special program that took me through school halfway in New York City, halfway in Dartmouth Medical School in New Hampshire. Yeah. I did my residency training in Newark, New Jersey, and I did a fellowship in minimal invasive surgery in Westchester Medical Center in New York as well. Wow. And then I came here for the job at Chambersburg Hospital.
That's incredible.
Yeah.
When you say working in trauma, anywhere that is close to Newark, New York City, I think everyone would say, I bet you were busy.
Oh, yeah.
when you have that much population, that concentrated a population, you can't help but have, obviously the numbers of accidents or, traumatic injuries goes up exponentially with the increase in population.
Yeah, that's extremely true. It was a bit of a knife and gun club over there in Newark, as well as a lot of motor vehicle collisions and pedestrian collision.
Wow. So you are now securely at Wellspan. Mm-hmm. We're certainly glad to have you in our area. You and I have spoken off air, and I'm already, in the few moments that we've had together, been so impressed with your demeanor and how kind. And I think that really makes a big difference when you're choosing a surgeon, when you're choosing a medical provider in general, is that one-on-one interaction with folks. Because I think when we, and a segue into this is, when we bring robotics into the mix, I think the perception is that is another level away from the provider. In reality, that's not the case. So explain to us why, when we're talking about the Da Vinci robot as it applies to Wellspan, how it does not remove you from the equation, quite the opposite.
No, the robot is simply a tool that we use to perform surgery. Mm-hmm. We're always using tools to perform surgery, whether it be our hands or the instruments that we use. Or if we're doing laparoscopic surgery, we use laparoscopic instruments. Or in the case of robotic surgery, we're using the robot as a tool to perform these procedures.
Now, speaking of procedures, what kinds of procedures are you using this robot for?
Yeah, so as a general surgeon, my most common procedures that I use the robot for are gallbladder surgeries, hernia surgeries. We can also use it for cases like appendectomies. There's a multitude of procedures that this robot is used for, especially in other fields as well.
Well, why is it, though, that the robot is more preferred of a tool to use for, say, hernia surgery?
Yeah, so the visualization is excellent. Mm-hmm. The camera, you can zoom in to almost touch the tissue. Okay. So you can get into very close spaces in the pelvis, particularly for hernia surgery, for inguinal or groin hernia surgery. Okay. That's a very useful tool to get into narrow pelvises and narrow spaces, as well as the dexterity of the instrumentation. So laparoscopic instruments, they only open and close like this. Yes. But the robotic instruments are wristed, so they move in the same way that my wrist does. So I have so much more dexterity and instrumentation, and that allows me to perform so many more motions that I can do inside the patient to avoid us from utilizing large incisions. So now we can do the procedures through very small incisions and do so much more within the body and avoiding big incisions.
And with avoiding the big incisions, am I correct in assuming that also greatly reduces the risk of infection?
Yeah, so there's a lot of benefits from avoiding big incisions and open surgery. So it reduces the risk of infections, but there's a lot of other benefits. So the big thing is pain after surgery.
Oh, right, yeah.
Yeah, so big incisions cause pain. That's unavoidable.
Right.
And so with smaller incisions and minimally invasive surgery, we're able to reduce the amount of opiates that patients require after surgery, reduce sometimes the length of stay after a procedure. Patients feel better and return to their normal activities sooner after some of these procedures. Yeah. It's overall just better for the patient.
I think too, when you say about the smaller incisions, correct me if I'm wrong, but when they were going over, when they had the people who were displaying the Da Vinci robot a few years back at the health fair, is the instruments are very small as well, that you or I, if we tried to use those in our hands, we would ultimately probably fail, but they can get so precise, not literally, but almost like to a microscopic level, it seems.
Yeah, they're very small instruments, so we can handle very small needles and stuff, and handle very delicate tissue without damaging it. And it's a instrument that we're using, the tool, the robot, and it's amazing that it can have that sort of control, that we can handle very delicate tissues without damaging it.
So take us through when you're in the operating room. I'm assuming you are physically in the operating room, as is the robot, and you can see we have a picture here of the Da Vinci robot as it is in an operating room setting here. So the robot is moved toward the patient. Incisions are made, however many are needed, correct? And then the tubes or take us through that whole setup.
Yeah, so I start at the bedside with the patient with an assistant. I start first by getting air or gas into the abdomen of the patient. That allows us to have the space that we need to do the procedure. And then we place ports, and those ports are where the instruments get passed through. Okay. The ports get connected to the robot machine, and then once everything is docked, then I'm allowed to go off to the console where I control the machine.
Okay. And you are, if I remember correctly, it's almost, you put your head to, there's eye holes?
Yeah, you look into the console. There's 2 cameras on the camera head for the robot, and that allows us to see just like we see every day. You need 2 eyes in order to see 3D vision. And so that camera allows us to see a 3D image inside that console. Wow. When you're doing laparoscopic surgery, you're just looking at a screen, and that is a 2D image. But when you look in the robot, you get a 3D image.
Really?
Yeah, it's amazing.
I vaguely remember that's incredible. And so, have you done both? Have you done just laparoscopic and also the robot? Is it night and day?
I wouldn't say it's night and day, but it is such a benefit to have the robot because you see so much better. And you realize that you end up having such a low tolerance for things like blood loss, because even the tiniest drop of blood looks like something significant to you. Okay. You do not tolerate it. You zap it as soon as you see it.
Wow.
When you're doing laparoscopic procedures and even greater degree for open procedures, that's not the case as much. So that's been my experience.
What's a procedure that historically has always been laparoscopic, but it's now suddenly we can do that with the more recent developments? I understand we've been using the robot for several years now, and the hernia surgery, but is there something where they said, we probably won't be able to use the robot for that, but now we can?
Well, this is outside of my field, but probably one of the more recent developments has been in cardiac surgery. Okay. They're now doing heart surgeries using the robot.
Wow.
Isn't that amazing?
Well, it is, but Dr. Caine, I got to tell you saying that to me, I'm actually surprised that hasn't been going on all along. You would think that's, look, you talk about minimally invasive, which is what this is, what the Da Vinci robot allows. makes sense for me. Use it anywhere you want, but especially, you don't want to invade the heart at all, right? So, but perhaps that's why it's taken so long, seemingly, because we have to make sure that what we're doing in that area is, proven.
Yeah, exactly. You're right.
Wow,
yeah.
That's incredible that happens. So what about in your personal experiences? Are there any stories, any patients that stand out to you as far as seeing a benefit from the Da Vinci robot?
So I've been able to help a wonderful couple. I've actually gotten their permission to speak about their story today. Kathleen and Robert Birch are two patients of mine. I met them at separate different times at my time here in Wellspan. Robert, I took care of. He's a 78-year-old man. I took care of him in maybe 2021 or 2022. He had cholecystitis, which was an infection of his gallbladder. So he was an inpatient in the hospital. And I was able to remove his gallbladder using the robotic system. Inpatient gallbladders where there's infection, and those can be very difficult cases. They can sometimes be dangerous cases because the tissues are all very inflamed. Things are stuck together. They can be very tough cases. And so I was able to take care of him using the Da Vinci system. And then I met his wife as an outpatient last year, late last year. And I was able to take care of her as well and take her gallbladder out. She was suffering from biliary colic, which is pain from having gallstones.
Okay.
And she was suffering daily after meals. And so we were able to do her as an outpatient, same day surgery. Her case took less than an hour.
Wow.
She had no pain afterwards. She didn't take any narcotics. She did so great. And so I was able to help both of them, and they're a lovely, lovely couple.
That's wonderful. I'm glad thank you for sharing that story, and we certainly thank them for their permission in doing that. But there are people that I know that have had robotic surgery, with the Da Vinci robot. Several of them have said, I wasn't even certain anything happened. If it wouldn't have been for the small incisions, I wouldn't have even known there was anything that happened. So I do have a question I kind of want to get in the weeds on with the story you just shared about that couple. The gentleman's name was what, I'm sorry? Robert. So when it comes to a case like Robert's, you removed the gallbladder in both cases, correct?
Yes.
Okay. So what's the size of the incisions on average?
They're about 1 centimeter, so 4 incisions for a gallbladder.
And how big is the gallbladder itself typically?
A gallbladder can be about the shape of an egg, a large egg.
So
sometimes bigger.
Okay, maybe you know what my question is then. How does it get it out? Yes.
So for Robert's case, he had gallstones. And his gallbladder was inflamed and enlarged. So what we do is we stretch one of the incisions. We choose, we usually have a typical incision that we remove specimens from. We have to stretch the incision, remove the specimen that gets placed in a bag inside the abdomen. We remove that through the bag. And then typically if the incision, when we have to stretch them, we don't want to leave that hole that size. We close that at the muscle level with a stitch. And in Kathleen's case, her gallbladder, she had sludge inside her gallbladder, which is really thick bile, like mud. And so I was able to suck the bile out through her skin and remove her specimen, her gallbladder out without having to enlarge her incision.
Incredible.
So I didn't have to close that port.
Absolutely incredible.
So that's why she did so great afterwards.
Now, is the robotic system able to be used for things like the weight loss bariatric surgery as well?
Yep.
Okay, so but basically, am I to assume that everything that we otherwise have heard about being laparoscopic is now more or less being transitioned, if available, to the Da Vinci robot?
They can be, yeah.
Wow, that's incredible. I can't thank you enough for. I could pick your brain for hours. I get so fascinated
there's a lot we
by
could
these
talk
things.
about, yeah.
There is, but I think that we just knowing that this technology exists at Wellspan Health, which is right up the road, and your offices with Wellspan Surgical Specialists are in Chambersburg. And if anyone wants to get in touch with you, what office hours do you have? How would they go about that?
Yeah, so at Wellspan Surgical Specialists, we have an office here in Chambersburg as well as Waynesboro. We have robots at both facilities. We have office hours typically from reachable from 8 o'clock to 5 o'clock in the afternoon. the office is open and reachable by phone.
Okay.
And our office number is 717-217-6800.
Okay. We've been speaking today on Let's Talk Tri-State with Dr. Akia Caine. She is general surgeon with Wellspan Surgical Specialists in Chambersburg. Dr. Caine, thank you so much for joining us today on Let's Talk Tri-State.
Thank you.
We'd love to have you back if you would come back. And maybe this is just one of those take a shot in the wind perhaps, but maybe just maybe we can come up and do a Let's Talk Tri-State and maybe get some video of the Da Vinci robot with you there taking us through that if you wouldn't.
That would be awesome. I'd love to do that.
I would love that. You can come to my work and I'll come to yours.
Ah, awesome.
Right. Thank you so much for joining us today on Let's Talk Tri-State.
Let's talk Tri-State.
If you'd like to be featured on an upcoming episode of Let's Talk Tri-State, call 717-597-9200 or email letstalk@921thegoat.com.